Modest Lifestyles. If you're coming across this channel for the first time, my name is Modesta. I'm a Nigerian currently based in Doha. If you haven't subscribed to this channel, what are you waiting for? Click on that red button that says subscribe. Do not forget to turn on your notification bell so that anytime we drop Obenge videos, you'll be notified. To my returning subscribers, those of you that just joined this beautiful family, I see you all. Thank you for your support. Guys, as you guys know, I am a nurse by profession, and I decided to share some misconceptions that people have about nursing, about nurses, okay? Especially in Africa. This is related to Africa. So if you are watching me and you are not an African, you will be like, what's she talking about? So this is related to Africans because I have most of my viewers are African and Nigerians, okay? Alright, if you are watching me and you are not an African, please leave a comment below and tell me where you are watching from, okay? If this is the kind of video you want to see, definitely you need to continue watching. Yes guys, so number one misconception that a lot of Africans have about nurses is nurses are not educated enough. Hey hey, you need to think again, guys. Nurses are educated. Nurses are educated. There are professors in nursing. Actually, to get a nursing degree these days is very hard. Very, very hard. I remember when I joined nursing, we were already admitted in nursing school, right? And they gave us 3 months, we call it PTS. So they gave us these 3 months to see if we can adjust, if we are ready to start our year 1. And we were told that our name is written with a chalk. Our name is written with a chalk, meaning that you have not yet entered nursing, even though they have accepted you, but still you are not yet entered into nursing school. So don't go and be telling people that you are in nursing school, because your name is not even written with a pen, it's written with a chalk. So nurses are educated, do not be deceived, guys. Now you are hearing it from a nurse. To get a nursing degree is not easy. Nurses are well educated. Number 2 myth or misconception people have about nurses is nurses only give injection. Nurses only follow instruction of the doctors. And nurses only clean the wounds. Nurses only give medication. Nurses do more than this, guys. Yes, we work hand in hand with the doctors, okay? We work according to doctor's order and prescription, but we are not doctor's servants. I was watching one LS a few weeks back, and this YouTuber was addressing somebody. She was having issue with one lady. I don't want to start calling their names. So I was in that LS, and this lady said to the lady that she was having issues with, look at you. I had wanted to be a nurse, but I told my dad I cannot tolerate seeing blood, and I don't want doctor to be telling me go there, go there. And I left a comment. I said, no, we are not pushed around by doctors, okay? We work hand in hand with doctors. Nurses doesn't just give medications, clean wounds. We actually draw our own plan. We actually, when we have a patient, especially if you are at the bedside, you have a nursing care plan. You have to give holistic care. You plan a care, and this is purely independent job of a nurse, okay? Not just about giving medication. So that is it. Another one is nurses only do night shifts. Nurses only do night shifts. No. Nurses, not all nurses do night shifts. Some, but not all nurses do night shifts. And not all nurses work at the bedside. There are different specialties, just like in medicine. There are these different specialties in nursing. So not every nurse is at the bedside. Some nurses are in the clinic, and clinic closes around 4 to 5 p.m. during the day, so they don't do night shift. Some nurses are in school, some nurses are educators, some nurses are in administration, nursing administration. Okay, so there are different, some nurses are not even working in the hospital, some are offshore, some nurses are working on the sea, some are working like the air hostess. We have nurses like that that work on air, okay? So it depends on your specialty. If you are working like in a medical ward, surgical ward, yes, you might be doing night shifts. Nursing job is only for women. Only women do nursing. No, there are a lot of male nurses these days. Even when I did my nursing back then in Nigeria, I had a lot of my classmates that were male. They actually do nursing, but what I've noticed is they prefer to go for psychiatric nursing after that. After their nursing degree, they will specialize on orthopedic, psychiatrics. These are most of my classmates, they went to this area, okay? Whereas the women will go for midwifery and become midwives. The next one is nurses are very rich, and nursing is a safe job. Nursing is not a safe job. It's not a moi moi to be a nurse. Nursing is a hard work. You have to be called to be a nurse. You have to be compassionate, you know, in order to deliver care to somebody who is in need. Nursing is not safe, but it's a very rewarding profession. It's not safe. Remember this era of pandemics during Ebola, SARS, now we have coronavirus. Nurses are the frontliners. They are the ones, you know, looking after those patients. So it's a risky job, but it's a rewarding one. And not all nurses are rich. It depends on your qualification, your education background, your experience, and where you are working. Of course, if you are a nurse in the US or UK, you make your money in dollars and pounds, right? They make a lot compared to nurses in other parts of Africa, I would say. So it all depends on your qualification and your experience. Alright guys, that's the end of it. If you enjoy watching this video, do not forget to give it a thumbs up, subscribe if you haven't, and I'll see you in my next one. Bye.